Highnesses, Excellencies, ladies and gentlemen, you've just heard the title of this next session, Mitigating the Risk of the Next Global Epidemic, which is perhaps a little bit of an irony, considering that we don't mention what we are going to be talking about, which is perhaps one of the most enduring taboos of modern time, that being mental health. Put simply, mental health issues remain one of the great unmentionable subjects. They can be difficult to admit, difficult to talk about, and difficult to confront in others. Question is, do we face a global epidemic? To discuss this today, I have an extraordinary panel. Thank you all very much indeed for joining us. Arianna Huffington, famed among her many achievements for the launch of the influential Huffington Post, of course, recently turned her attention to mental health issues with a book on the importance of sleep. Dr. Mehmet Oz is a cardiothoracic surgeon, Columbia University professor and famed TV host. I'm in the presence of greatness here today, also an advocate of alternative medicines. And finally, Professor David Clark of Oxford University's Department of Experimental Psychology, a leading expert in the understanding and treatment of anxiety disorders. Please, ladies and gentlemen, join me in welcoming our panel to the World Government Summit.
Thank you. Thank you.
Arianna, I want to start with you. You have been outspoken in your advocacy and support for mental health issues, and this is personal. Explain, if you will.
So, first of all, thank you so much. It's really great to be here. My personal story is that in 2007, 2 years into building the Huffington Post and the mother of 2 teenage daughters, I collapsed from exhaustion, sleep deprivation, and burnout, hit my head on my desk, broke my cheekbone, and as I started the journey of trying to understand what had happened to me, I discovered that what had happened to me, which was collapsing from burnout, was actually a global epidemic. And that all around the world, millions of people have been living under the delusion that in order to succeed, they have to be always on, that sleep is optional. And that has led to an incredible crisis, both in mental health and in chronic diseases. We have an explosion, including here in the region, in diabetes, obesity, heart problems. And the reason why I left the Huffington Post to launch Thrive Global is because we have an opportunity to address these problems and find solutions by focusing on behavior change that will change the outcomes.
Before we move on and talk about some of these solutions, tell me, when you were in that sort of downward spiral, the fall as you describe it, did you seek help? And if not, why not? Did you talk to anybody?
No, the whole point. That's really, unfortunately, the problem. I didn't think there was anything wrong with sleeping 4 hours and being always on. In fact, if you had asked me that morning, Arianna, how are you? I would have said fine. Because what happens to us is that we're so used to running on empty that we've stopped remembering what it feels like to be fully recharged, to be fully present in your life. And unfortunately, a lot of us do that in the course of achieving, succeeding, and yet our performance is undermined because performance is a product of the quality of our energy, not how much time we put in.
I have no doubt that Arianna's story is familiar to many of us here in the plenary hall. But let's not take my word for it. Audience, how many of you have felt or know someone who has felt unduly stressed, anxious, has experienced depression? Just hands up, if you will. Good for you. And that's a lot of people in the room. I say good for you because there is such a stigma attached to any discussion about mental health, and that, I think, is something that we should talk about here. When we talk about mental health as the next global epidemic, Dr. Oz, are we being unduly alarmist?
I don't think so. The Lancet just published a commission report on global mental health, $16 trillion costs estimated by 2030. Roughly 20% of anyone who's over the age of 50 feels significant enough stress to impact their life. We have a survey called the Real Age Study. Maybe 35, 40 million people have taken it. In that survey, we look at how old your body thinks you are. And when you have major stress in your life, it takes 6 years off your life expectancy. So it's not just a soft issue. Now, why is that? Sometimes it's because mental health issues affect your body. It does cause illnesses, things like hypertension, heart disease, stroke. Sometimes it's because you start taking drugs. In the United States, for the first time since we've been measuring it, male life expectancy, white male life expectancy is dropping. People living shorter than they used to. Much of it because when men don't work, they become addicted to something. And without the purpose of work, we're seeing that now with manifesting an opiate addiction. People commit suicide. It's the #3 cause of death in young people. So these are massive issues. And then there's sometimes physical problems cause mental health. So endocrine problems like the thyroid, neurologic disorders like Parkinson's, very commonly associated with mental health issues, chronic pain syndromes like fibromyalgia result. But let me bring it very clearly to the UAE. We have a business where we measure people's sleep. You just use the bottom of the phone. It's free. It's called Sleep Score. There are many people in the UAE who use this app. We have millions of people around the world, so we can compare countries. So I ran this study over the last few months for the UAE versus the Western world. In the UAE, you lie in bed for 3 minutes shorter than people who live in the United States, for example.
3 minutes shorter?
3 minutes shorter, you lie in bed. But your sleep quality predicts that you're actually sleeping 5 hours and 38 minutes only, which is 20 minutes shorter than in the West. To give you an idea of impact, sleeping pills get you about 9 minutes more sleep on average. So you have to take twice as many sleeping pills. You can't, obviously, but to get the same impact. Now, why? Is it because it's too hot in your room? Is it because you're stressed out? Is it because you're always using your phones? We don't know. But when you can compare countries, there's no reason why people in the UAE are not doing as well as people elsewhere. And sleep is a barometer of stress, a pretty direct correlate to stress. So it tells me that there's a special stress here. I know that's been in the media in this region. So it's something that's worth focusing on.
Yeah, that's a very good point. And those who live in the UAE will be well aware that there was a report recently published in the local press here which suggested as many as 80% of people here suffer from stress. And that was from adults right down to kids. So this is a country that isn't immune from this. And also, I think, in a very positive way, a country which is prepared to admit that these issues exist and want to do something about it. Professor, why is the burden of depression and other mental health conditions on the rise globally?
Well, I don't think we're entirely sure, but obviously social media is one of them, and the stress in our jobs and lack of sleep is another key one. But the key thing is that there are things we can do about it. The most advances we've had in recent years has been developing psychological therapies. There are now effective psychological therapies for most common health problems, but the problem is that in most countries the public doesn't benefit. Surveys show that people prefer psychological therapy to medication at a ratio of 3 to 1, but in no way are they getting it. And that's an enormous shame because it has a strong economic argument for delivering it. Following Arianna, Richard Layard and I laid out the economic argument in our book, Thrive. Clearly, we all, as societies, lose a lot of money through mental health problems. It depresses our GDP by 4 or 5 percentage points. But that is unnecessary because if you make psychological treatments more widely available, that can be done at no excess cost, but considerable gain. That's because people end up having less physical health care costs as they recover from their mental health problem, and they're more productive in the labour market. So in England, the government has been trying to make psychological therapies more widely available recently, by training up a new workforce, about 10,000 people so far, and deploying them in specialist psychological therapy services, and critically measuring the outcomes of everyone who's treated to see whether or not it works, see whether the investment is worthwhile. And the results are very good. It's been going for 10 years. We're now treating about 1 million people a year. Not everyone needs a full course of treatment. Some just get advice and assessment. But about 560,000 people get treated every year. We get measures of how much they've improved at the beginning and end of treatment on 99% of those people. What are the sort of outcomes? Well, 7 in every 10 people show substantial improvements in their anxiety and depression, and 5 out of 10 recover. And you can see that on this graph here. The clinical trials research says that if you do it really well, you should be able to get about 50% of people recovering, other people benefiting. That's the red line you see behind me. So the government very controversially said, well, let's see if we can do as well as the research studies in a mass program. Well, as you can see, it was pretty difficult. For the first few years, we didn't get there, but we've got there now, and we've got there because we're transparent. We record all the outcomes, and you can see the outcomes of every service on a public website, and you learn from those outcomes, and the things we've learned have helped us to improve the system. So it's important that people get a really good assessment at the start of treatment so you know what you're focusing on. It's important that they're seen in a short period of time. We find you get the best results if treatment starts within 6 weeks of people referring themselves. If you wait longer, you don't get such good results. We also find that it isn't any old psychological treatment you give them. You have to give them the right evidence-based ones. And lastly, just like with drugs, there's a dose-response effect. You need to have an adequate dose. But once you get that, you do incredibly well, so much so that our government has now committed to doubling the scale of the program in the next 5 years. So we will be seeing 2 million people every year quite soon.
Which is interesting. Go on, Arianna.
Yeah, I was going to say that what is wonderful about that is it shows that there are multiple points of intervention. So in the UK, the government has intervened. But we find that in many countries around the world that we are working with, the interventions happen through business. And what is amazing about that is that it's an incredibly easy entry point, because you can very easily demonstrate to the CFO, not just to the head of HR, that it's going to have a direct return on investment, because it's going to affect engagement and productivity, obviously, but also it's going to affect hidden and obvious healthcare costs. It's going to affect attrition, and therefore have a real positive effect on the bottom line. And here in the region, I'm delighted that we've partnered with SAP, and we're bringing it to all the thousands of clients as a way to affect not just the employee, but also the employee's family.
And this is important because as the UK, you suggest, has a very good example of how to embed a policy across a number of governments. And you're talking about this starting during a Labour government in the early 2000s and carrying on and actually improving over to two Conservative governments. So we bring ourselves to the United States of America, and during the State of the Union address the other day, the US President didn't mention mental health at all. Dr. Oz, it is incumbent, surely, upon not just governments, but businesses, communities, that mental health issues are talked about and addressed with the sort of opportunities that Arianna's just been suggesting.
Well, there's 2 different problems that I think are causing stress that require different types of interventions. I think loneliness, which is at epidemic proportions, it needs to be addressed at a personal level. And we know that when we look at places where people live a long time, things like family first, the right tribe, being with groups of people that you can talk to, the importance of having some person that's really close to you, usually a spouse. These are all evident. Those are harder to implement, but you can make it easier for that to happen. And I'd be curious David, how you make that happen within that 50% number. There has to be some way of helping that. But then there's the other side of mental health, which results when you're deprived, when you're at risk, when you're scared. So I spent a fair amount of time working I'm Turkish, working at the Turkish-Syrian border with the refugees, and there, half the people that I work with in the big camps are children. And those children have post-traumatic stress disorder. So influencing what they feel now changes their life, right? They can become world leaders or they can become nothing. And we have a lot of control over those. That's more our government intervention. David, can I ask you one related question, just because I'm looking at your slides? There's two kinds of depression, right? There's the depression because you have a chemical imbalance, and then there's depression because your life is terrible. You're living in a really bad place, and depression is sort of forces you to change because it's not a good thing to experience. How do you decide whether...
Let me just say just one more thing that is very important. There is depression and anxiety that are independent of your circumstances. You know,
Yes.
there are hundreds of millions of people who are depressed or anxious, but who are not refugees. So they are not like having circumstances that you can clearly say, I can understand why you're depressed.
Sure.
And I think that is kind of the fastest and most available entry point for us.
Arianna, some of those people would be better treated with chemicals, medication. Some of them are better treated.
No, not chemicals and medication. I'm talking about people whose levels of stress lead them to either depression or anxiety because they are living in a perpetual fight or flight mode. And their whole system is flooded perpetually with the cortisol hormone, so they feel as though they're constantly at war or a lion is chasing them. So we've partnered with Stanford to be able to do interventions earlier and earlier, because the ideal thing would be to go upstream and stop people from becoming depressed and anxious by simply addressing a certain two factors, for example, that are very prominent in both depressed and anxious brains, but also pre-depressed and anxious brains. And this is one is rumination, when people think over the same thing again and again, or negative bias, when they see the world in dark colors all the time. So given that we're not going to be able to eliminate the stigma overnight, if we can do interventions, that's what we're doing in businesses, that present it as addressing stress and burnout. So people can come and participate.
So David, what works? What actually works from a professional perspective?
Yes, so there are two things, and you want to focus on both. One is the outer life, societal change, reducing stress levels, and the other, of course, is the inner life, because we can't remove all stress, and so we need to teach people ways of being more resilient to stress. And that's really what the sort of psychological therapies do. And it's why in the UK they're now really recommended more strongly than medication, even for those people who their depression seems to be fairly autonomous. And that's because, of course, they learn skills for dealing with problematic emotions which they can keep for the rest of their life. So, you know, one of the extraordinary research findings is that if you look at people who have multiple episodes of depression, and there doesn't seem to be a lot of triggers for them in the external world, the thing that actually prevents them best is mindfulness, not extra medication, because they're learning an inner skill to utilize.
How destructive is social media these days? How much impact does social, that's probably a rather loaded question of mine, how much of an impact does social media usage have on people's levels of stress, anxiety, and possible depression?
Well, so we've seen the largest increases in mental health rates in the sort of 16 to 25-year age range, and it's very likely that that's very important there. And so dealing with that is a big issue. But even, you know, if we dealt with that, we'd still have very high rates of anxiety and depression. And so I think that's not the solution on its own. I think one has to really focus on people's inner reality and teach them the skills, starting in school and then throughout their lifespan.
I think David is absolutely right. You know, we're never going to eliminate stress from our lives. But if we can give people the tools to be more resilient, and when it comes to social media, the reason why depression is particularly present among women, and especially young women, especially teenage women, is because of the constant comparisons that go on. Before your own sense of identity is fully formed, you're constantly comparing the messy reality of your life with somebody's curated, perfect life. and you have these massive instances of FOMO, fear of missing out. So we've introduced on our Thrive Media platform the concept of JOMO, the joy of missing out, and helping people, be joyful in their own lives, in whatever they're doing, and not constantly compare themselves with someone else.
And that's an issue, isn't it? This constant comparison, which seems to have been sort of perpetuated by the use of social media over the past sort of decade or so.
We run surveys on my show in order to figure out where the audience needs the most help, and that is the single biggest problem that we're seeing. And I think David and Arianna are both highlighting that reality. But the part of the puzzle that's more challenging for me is related to two factors. One is financial stress. We know of the top 10 stressors, 7 have a financial element to them on the real age study. So we just numerically, those tend to be important. And things like divorce are really financial stressors for many people because the relationship itself has collapsed. And then the second is a belief that the world is not as good as it was when you were handed it. And that is an interesting phenomenon because objectively, the world is much better off. We were blessed to have a conference. Arianna and I were present with one of the ministers speaking of how he was born here in Dubai, July 22nd, 1961. I remember because my wife was born 2 days before. And he said he was born in a house with no water, no electricity, no road to the house. And that's not far from where we are today in terms of time, but remarkable in terms of accomplishments. So how can we think our world is not a better world today? Yet, it's not just social media, it's how we're peppered with information. So yes, you need more resilience, but we also need to reboot what we expect from our lives, or else we're never going to be happy. Because if this doesn't make us happy, living in a relatively peaceful place where, yes, you have access to news from 200 miles away, but it's not your news anymore, then it's a recipe for disaster.
And that's easy to say, but when you live in a country like the UAE, which is constantly evolving, I observe how hard people work here just to sort of keep up with what is expected of them in what is this incredibly dynamic, evolving space. Both of you are proponents of taking care of yourselves from a sort of holistic point of view. I mean, just how important is that?
So I think the key here to realize that it only takes micro steps. We're not talking about going off on some retreat or chilling under a mango tree. We are talking about introducing micro steps in your daily life that transform your experience, to David's point, transform the way you experience and relate to stressful circumstances. And let me give you two of my favorite micro steps. At Thrive, we have over 700, but my two favorites are pick a time at the end of your day that you declare the end of your working day. Because the truth is that I bet everybody here, and I know everybody on stage, never has a real end to your working day. You could keep working all night. You could keep answering emails, texts, etc. So you have to declare an artificial end to your day in order to be able to fully recharge and sleep well. The reason why people can't sleep well because their brains haven't really slowed down. So, and because human beings learn through ritual, the way you mark that end of the day is by taking your phone, turning it off, and charging it outside your bedroom.
How often do you do that?
Every night.
Do you?
Yes.
Honest?
You know why? Because I don't like myself when I wake up in the morning tired. I don't like who I am. I don't know if you can identify with me, but when I'm sleep deprived and exhausted, I'm more irritable, I'm more emotional. I'm not as creative, I'm not as empathetic. I don't want to be around me, and I have no choice. So I prioritize it. So that's one step. The other step is when you wake up in the morning, take 1 minute, just 1 minute. If you don't have 1 minute, you don't have a life. Take 1 minute before you go to your phone to remember what you're grateful for, to set your intention for the day. Because if you think of it, your phone is the repository of everybody's demands on you. So start your day with recognizing what do you want out of that day and what makes you happy. I think it's incredibly significant that you have a Minister of Happiness here.
Thank you. I wonder how many people in this room turn their phones off, charge them outside of the room, and take that time in the morning before you start again to sort of reflect on where you are and who you are. Anybody, anybody? Well done.
Bravo.
There's two or three people.
Can I offer
So, you know,
one
I
more
would
suggestion
love
that might
you-
be beneficial? To Arianna's
Yeah.
point, one nice thing about exercise is you really can't answer the phone usually when you're doing it. And I think the 1-minute idea is brilliant in the morning, and if you have 6 minutes, which most of us have, most of us would be embarrassed to think we don't, I do a little yoga. It's more like a calisthenics yoga, but it's so short, by the time you start, you're almost done. And it's a tactic that you might want to try, because at least for those few minutes, you own your day. Then the rest of the day, you can think to yourself, I'm accomplishing a little something in my own well-being using physical activity. And when we look across the globe at people who live the longest, the one thing, because they don't all have the same social culture, they eat different foods, but the people who live the oldest all have daily rigorous activity. They do something that moves their body. I think part of the reason that works is it de-stresses us and deals with our brain. David, I don't know if you have data on that from your study, but physical activity, I suspect, is an important part of that 50% success rate.
Yes, so exercise is part of these psychological therapy programs and is very helpful. Although I think the thing I've learned really is, you know, I've got grey hair, so I've been around for a while. And in my lifetime, there have been many different initiatives for mental health, and they've all sounded good ideas. But then a government changes and everything changes. And so I think the extra thing I would want to say is whatever you do as a society, measure its outcomes and look at them and scrutinize them and learn from those. And I think that's the radical bit of the UK program, that we have a mental health service where everyone's outcomes are observed and we publish. Anyone with a mental health problem anywhere in the country can look at the outcomes of every single improving access to psychological therapies program and can see what their chances of recovering are if they go to this one or that one. And that produces a competition between the services and makes them better. And so, and that is the way in which we move forward. So we need good ideas, but we then need to collect the data to fine-tune their implementation.
And that's really what is so great about businesses, because businesses collect the data and they measure the outcome, they measure the results. Otherwise, they would stop funding this.
You're talking about return on investment, effectively, aren't you?
You talk about return on investment. And one of the things we have found moves the needle faster than anything is people writing about their own experiences. Like the people here who raised their hand when you asked how many sleep apart from their phones or take a minute in the morning to remember what matters in life. You know, if you can write your experiences, we would love to publish them on Thrive. I'm going to give you my email address, and you can send them to me, ah@thriveglobal.com. And the reason for that is that it's almost like as we're shifting the culture, we need to hear from each other. We need to hear what somebody else is doing.
The statistics that we've got, less than 2 minutes left. The World Health Organization estimates 450 million people experience mental or neurological disorders around the world. These disorders constitute 5 of the 10 leading causes of disability worldwide. As a closing thought from each of you, that sounds incredibly depressing, excuse the pun, as it were. Should we feel optimistic? Because if we've agreed that we are not being alarmist about this being the next global epidemic, it sounds as if there are lots of ways that we can avoid this epidemic.
Our species, 90,000 years ago, came through this area, prospered across the planet, primarily because we could communicate with each other. Our prefrontal cortex grew the size it is because we had to read each other's faces. We need a walnut-sized brain to go hunting. And yet, within 10,000 years, you probably had wiped out all the other humanoid species, and we have thrived since then. But we don't trust ourselves. And I'm very optimistic because I know when we speak to each other, we have the ability to make incredible things happen. Just witness what's happened in the UAE, and you see that firsthand. But we should be applying it to stress. We just haven't paid attention to it.
David.
Yes, I think we certainly do so. It's a time of great optimism because we have treatments that work very well. They're just not implemented. But they can be implemented at zero net cost because of the savings, and you can demonstrate their value in society. So that's part of the solution, but of course many of the things that Arianna is doing is also part of the solution. So I think this is an epidemic which is different from many ones because we actually have the solutions, so we just get on and implement them.
And the fact that we are talking about it here at the World Government Summit has to be a good idea. And by the way, I think we should applaud the fact that we are having this session. Arianna.
Yes, and I think we should applaud the fact that you have a Minister of Happiness as well as a Minister of Artificial Intelligence, because it shows that we are not putting all our bets on technology, that we are recognizing that at the same time that we are advancing technologically, which is so important, we need to keep cultivating the soft skills of empathy, of emotional intelligence, of that inner life that David spoke about, that give us the resilience we need to deal with the future and be optimistic about it. So I'm very grateful to be here and to see the amazing work being done in the region. And I know that if that continues, it's going to be an incredible impact for the future. And please tonight try as an experiment to sleep apart from your phone and reconnect in the morning, and your phone will be fully recharged and you will be fully recharged.
Thank you. Thank you. What a fascinating discussion. Thank you all.